Hello, people. So, antileprotic drugs. Today's topic classification of antileprotic drugs is sulfone, dapsone जिसको हम DDS बोलते हैं, phenazine derivative, clofazimine, antitubercular drugs में आ गया rifampin, ethionamide, and other antibiotics, ofloxacin, moxifloxacin. Now, what is leprosy? Chronic granulomatous infection caused by Mycobacterium leprae, primarily affecting skin, mucous membrane, and nerves. So the classification of leprosy by Ridley and Jopling, it is LL, BL, BB, BT and TT. LL means lepromatous, BL means borderline lepromatous, BB means borderline, BT means borderline tuberculoid, and TT means tuberculoid. Now, the difference between tuberculoid leprosy and lepromatous leprosy is very important. So, tuberculoid leprosy में anesthetic patch होता है, means dry patch. यहाँ पे cell mediated CMI immunity is normal. सो हेयर मतलब सेल मीडिएटेड इम्यूनिटी प्रेजेंट होती है. लेप्रोमन टेस्ट पॉजिटिव होता है. बेसिलाई रेयरली फाउंड इन बायोप्सीज. प्रोलॉन्ग्ड remissions with periodic exacerbations. Now, the lepromatous leprosy, diffuse skin and mucous membrane infiltrations, nodules. CMI means cell-mediated immunity is absent in lepromatous leprosy. Lepromin test negative. Skin and mucous membrane lesions teeming with bacilli. Progresses to anesthesia of distal parts, atrophy, ulceration, absorption of digits, etc. Now, NLEP 2009 classification of leprosy. NLEP is National Leprosy Eradication Program. It divides the leprosy into paucibacillary leprosy and multibacillary leprosy, PBL and MBL. Paucibacillary leprosy, patient has few bacilli and is non-infectious, includes TT and BT types. 1 to 5 skin lesions are present, no nerve or only one nerve involvement, skin smear negative at all sites. Multibacillary leprosy, patient has large bacillary load and is infectious, includes LL, BL and BB types. 6 or more skin lesions, more than one nerve involvement, irrespective of number of skin lesions. Skin smear positive at any site. Now, we will learn about the multi-drug therapy, MDT, of leprosy. It's given in KDT. Now, multibacillary leprosy ka treatment is for about 12 months. So, we'll give rifampicin or rifampin 600 mg once monthly supervised. Clofazimine 300 mg once monthly supervised. Clofazimine 50 mg once daily for 28 days unsupervised. Dapsone 100 mg once daily for 28 days unsupervised. Now, the paucibacillary leprosy, its treatment is for 6 months. And here we'll give rifampicin and dapsone. Clofazimine नहीं देते हैं. So rifampicin 600 mg once monthly supervised and dapsone 100 mg once daily for 6 months. So multibacillary के लिए होता है 12 months and paucibacillary के लिए 6 months. Now, in case of resistance, we can use the ofloxacin, minocycline and clarithromycin. Now, some reactions are present in the leprosy. We'll call these as lepra reaction. They occur in LL, coincides with intercurrent infection or institution of chemotherapy. Reaction due to release of antigens from killed bacilli. So, lepra reaction क्यों होती है? Due to release of antigens from killed bacilli. These are of two types, type 1 and type 2. टाइप 1 होती है रिवर्सल रिएक्शन, जिसको हम डिले टाइप ऑफ हाइपरसेंसिटिविटी रिएक्शन बोलते हैं. एंड टाइप 2 इज टाइप 3 hypersensitivity reaction. Okay, here type 2 is type 3 hypersensitivity reaction. वो भी आर्थस टाइप की होती है. It's a mild, severe or it can be life threatening. So for example, erythema nodosum leprosum, ENL, erythema nodosum leprosum. Now, इसका जो ऑनसेट होता है वो एब्रप्ट होता है. Existing lesions enlarge होते हैं, become red, swollen, painful. Several new lesions may appear and the patient may suffer from malaise, means the feeling of being unwell. So, treatment of lepra reaction is temporary discontinuation of dapsone in severe cases. Clofazimine 200 mg daily, except in severe cases. जो क्लोफाजिमीन होती है एंटी इन्फ्लेमेटरी प्रॉपर्टी होती है इसमें. एंड फॉर द ट्रीटमेंट ऑफ लेप्रा रिएक्शन वी कैन गिव प्रेडनिसोन एंड ऑल्सो थैलिडोमाइड. जो थैलिडोमाइड होती है बहुत ही हाईली टेराटोजेनिक ड्रग होती है. बिफोर इट वॉज गिवन फॉर द मॉर्निंग सिकनेस in pregnancy, but now it is contraindicated in pregnancy. Despite of 2-year multi-drug therapy, some patients continue to harbor viable Mycobacterium leprae, means these are persisters. Okay, if patient relapse, patient के treatment के बाद भी अगर patient को फिर से leprosy हो जाती है, then treat them with MDT, multi-drug therapy, because dormant bacilli remain sensitive to the same drug. So if patient comes to you, you have completed his or her treatment, after some years they'll come and we'll give the same MDT treatment because the dormant bacilli remain sensitive to the same drugs. Let me show you the picture of the tuberculosis leprosy. Here we can see the anesthetic patches, means ये dry patches दिख रहे हैं हमें. And next we'll see with the leprosy infection. We can see the nodular diffuse skin infiltrations दिख रहे हैं पूरे face पे. This is an picture of the lepromatous leprosy. Here ends the lecture.